Improve your local public welfare through an innovative public-private co-production approach. Let's have a look at a good practice and its replicability. The roadmap for replicability, piloting socially innovative public welfare programs, MedTOWN Local Digital Complementary Currency, identifies key contextual determinants that we can consider as key ingredients to replicate this good practice. This roadmap also describes the process that led to the implementation of the good practice, the key actors involved, the main resources used, and the core activities that were undertaken. The good practice entails an interesting public-led local complementary currency scheme, which was piloted in the Cerro Amate District in Seville, Spain, within the framework of the MedTOWN project. In brief, the public expenditure destined to the Municipal Cash Assistance Program is delivered to low-income beneficiaries in the form of electronic money. The model allows for any private citizen, organization, or enterprise of the local community to voluntarily participate in the local currency initiative. The higher the recirculation of the electronic money within the local circuit, the greater the direct and indirect advantages for the local community as a whole. The potential social and environmental impacts that this model can generate include the promotion of local responsible consumption and production, the enhancement of the local consumption and reduction of the carbon footprint, local job creation, the strengthening of the community social cohesion and social inclusion, the increase of the community well-being and quality of life, the improvement of local public administration through digitalization and more cost-effective and evidence-based public policies. To replicate this good practice, the following key ingredients should be in place in a given territory. Among key actors, a truly committed local public authority leading the initiative with solid political will, a competent promoting social and solidarity economy actor, and a skilled technological operator. Some degree of openness to innovation and mutual trust in the local community. A relatively stable social and political context. A decentralized public administrative system with proper conditions to innovate, which means not overwhelmed with complex and traditional bureaucratic procedures, nor too pressured by tight legal scrutiny. Public welfare services also should not be overpressured by high demand. A governance model where the local authority holds the leading role, but also includes some forms of community participation. Possible drawbacks and risks may arise in future replications of this good practice. For this reason, the roadmap suggests potential coping strategies for prevention and mitigation of such risks. If you're interested in knowing more about this good practice, or even to replicate it in another context, we invite you to read the Roadmap for Replicability. The roadmap is freely accessible on the MedRiSSE Widened Community of Practice wiki page that you can find by clicking on this link. On the wiki page, you will also find 4 other roadmaps that analyze good practices promoting the social and solidarity economy and public-private collaboration.